Every single day, millions of people over 55 flush the toilet without looking down, missing warning signs that could save their lives. Right now, your body might be sending you urgent messages through something as simple as the color, shape, or rhythm of your bowel movements. And here is what most people do not realize. These signs appear weeks, sometimes months, before any pain starts, before any discomfort at all. You assume everything is fine because nothing hurts, but colorectal cancer does not always announce itself with pain in the beginning stages. What you see in the bathroom today could be the earliest warning you will ever get, and ignoring it could mean the difference between early detection and a late diagnosis. In this video, you are going to learn 7 specific bathroom signs that appear before bowel cancer causes any pain, signs that are easy to spot. These are changes your body shows you in the toilet, and I will explain exactly what each one means, why it happens, and when to take action. The last sign on this list is completely invisible to the naked eye, and it is the one that surprises doctors the most when they finally catch it. If this information helps you today, please hit the like button and subscribe to this channel so more people can learn how to protect their health. Share this video with someone in your family who is over 50, because early detection truly saves lives, and leave a comment telling me, do you pay attention to changes in your bathroom habits, or do you usually just flush and move on? Colorectal cancer, also called bowel cancer, is one of the most common cancers in people over 55, and age is the strongest risk factor. Most people believe that cancer always causes pain first, but that is one of the most dangerous myths about this disease, and it costs lives every year. Studies published by major cancer research centers confirm that early-stage colorectal tumors grow silently, often without causing any discomfort at all. By the time pain appears, the cancer has usually grown large enough to press on surrounding tissues, and that means it is already in a more advanced stage. But here is the good news. Your digestive system communicates with you every single day through your bowel movements, and it sends clear signals. Researchers have identified specific changes in stool appearance, consistency, and frequency that can appear months before a tumor causes any physical pain. Medical guidelines now recommend that people start colorectal cancer screening at age 45, because catching it early means it is highly treatable. What you're about to learn are the exact signs that doctors look for when they evaluate patients, and these are changes you can notice yourself at home. Sign number 1, a lasting change in your bowel habits that does not go away after a few days, and this is one of the earliest warnings your body gives. You might suddenly develop diarrhea that continues for weeks, or constipation that feels different from anything you have experienced before in your life. Some people notice they start alternating between diarrhea and constipation without any clear reason, and this pattern persists day after day without improvement. The key word here is persistence, a change that lasts longer than 2 to 3 weeks, especially if you have not changed your diet or started any new medication. When a tumor grows inside the colon, it can partially block the passage, and this changes how waste moves through your digestive system, creating these new patterns. Most people assume it is stress, something they ate, or just getting older, and they wait weeks or even months before mentioning it to anyone at all. Studies confirm that many colorectal cancer patients report this exact symptom months before diagnosis, but they dismissed it as a minor digestive issue at the time. What to do? If your bowel habits change suddenly and the change lasts more than 3 weeks, write down what you are noticing and schedule a doctor visit. Keep track of how often you go, whether the stool is loose or hard, and if anything else feels different, because these details help your doctor understand what is happening. Do not wait for pain to appear before taking action, because this sign appears specifically before pain starts, and that is exactly when treatment works best. Important warning: do not assume it is just your diet or stress without getting it checked, especially if you are over 55 and this pattern is completely new. Many people try changing their meals, drinking more water, or taking fiber supplements, and while these things are healthy, they should not replace a medical evaluation. This sign alone does not mean you have cancer. It can be caused by infections, food intolerances, or inflammatory bowel conditions, but persistence is the red flag. Your doctor can perform simple tests to rule out serious causes and give you peace of mind, and early detection at this stage means the best possible outcome. Sign number 2, your stool becomes pencil-thin or ribbon-like, much narrower than it used to be, and this change happens gradually over several weeks or months. Normally, stool has a certain width because the colon is a tube with a consistent diameter, and waste moves through it without any obstruction or narrowing. When a tumor grows inside the colon wall, it can narrow the space where stool passes, and this forces the stool to become thinner as it squeezes through. Think of it like a garden hose. If something presses on the hose from the outside, the water that comes out becomes a thin stream instead of a full flow. Many people over 55 notice this change, but assume it is normal aging or related to their diet, and they do not mention it during doctor visits. Research published by gastroenterology centers shows that persistent stool narrowing is one of the classic warning signs doctors ask about when evaluating colorectal cancer risk. The important detail here is consistency. If your stool is occasionally thin, that is usually not a concern, but if it stays thin week after week, that is different. What to do? Compare the width of your stool now to what was normal for you 6 months ago, and if you see a clear difference, take note of it. Mention this change to your doctor, even if nothing else feels wrong, because this sign alone is enough to warrant a closer look, especially in people over 50. Your doctor might recommend a colonoscopy, which is the gold standard test, because it allows them to see inside the colon and remove any polyps or growths immediately. Important warning: do not dismiss this sign just because you feel fine otherwise, because colorectal cancer often progresses without causing pain in the early stages. Some people delay seeing a doctor because they think thin stool is caused by hemorrhoids, but hemorrhoids do not usually change the width of your stool consistently. This sign is especially important if it appears together with another sign from this list, because multiple changes happening at once increase the urgency of getting evaluated. Catching a tumor at this stage, before it causes pain or spreads, means treatment is far simpler, and the chances of full recovery are incredibly high. Sign number 3. You feel like your bowel never fully empties, even right after you have just gone to the bathroom, and this sensation does not go away. Doctors call this feeling tenesmus, and it is the persistent urge to have a bowel movement even when there is little or nothing left to pass through your system. You sit on the toilet, you go, and then 5 minutes later, you feel like you need to go again. But when you try, almost nothing comes out at all. This happens because a tumor in the lower part of the colon or rectum can create a sensation of fullness or pressure, tricking your body into thinking there is more. Many people over 55 assume this is just constipation or part of aging, and they try drinking more water or eating more fiber without seeing any real improvement. Studies confirm that this incomplete evacuation feeling is one of the most commonly reported symptoms in people later diagnosed with rectal or lower colon cancer. What to do? If you have this sensation for more than 2 weeks and it does not improve with diet changes or hydration, write it down and bring it up. Your doctor will ask you specific questions about this feeling, and they might perform a digital rectal exam or recommend a colonoscopy to check the lower colon. This sign is particularly important because it often appears before any visible changes in the stool itself, so it can be one of the earliest warnings you get. Important warning: do not treat this symptom yourself with laxatives for weeks without seeing a doctor, because overusing laxatives can mask the underlying cause. Some people assume they are just constipated and keep taking over-the-counter remedies, but if the feeling persists, the cause might be something that needs medical attention. This sensation can also be caused by hemorrhoids or inflammatory conditions, but the key is to rule out serious causes first, especially if you are over 55. Ignoring this sign because it is not painful is one of the most common mistakes people make, because colorectal cancer does not always hurt in the beginning stages. Getting evaluated early, when this is the only symptom you have, means you are catching the problem at a stage where treatment is straightforward and highly effective. Sign number 4. You notice mucus in or on your stool, a clear or slightly cloudy substance that was not there before, and it appears regularly. The colon naturally produces a small amount of mucus to help stool move smoothly through the digestive tract, but you usually do not see it in the toilet. When a tumor develops in the colon or rectum, it can irritate the lining, and this irritation causes the colon to produce more mucus than usual as a response. You might see it coating the stool, mixed in with it, or even on the toilet paper, and it can look like clear jelly or a cloudy, slimy substance. Many people assume mucus is caused by a stomach bug or something they ate, and they wait for it to go away on its own without seeking medical advice. Research published in medical journals shows that persistent mucus, especially when it appears alongside other changes, is a sign doctors take seriously during cancer evaluations. What to do? If you see mucus more than once or twice, and it keeps appearing over several weeks, make a note of it and mention it to your doctor. Your doctor will want to know if the mucus appears alone or with blood, and whether you have any other symptoms like cramping, diarrhea, or weight loss. Mucus can also be caused by infections, inflammatory bowel disease, or irritable bowel syndrome, but the only way to know for sure is to get evaluated properly. Important warning: do not ignore mucus just because it does not come with pain, because colorectal tumors often produce mucus long before they cause any discomfort. Some people see mucus for months and assume it is normal for them, especially if they have a history of digestive issues, but new or increased mucus is always worth checking. This sign is particularly important if you notice it together with blood or a change in bowel habits, because multiple signs appearing together increase the urgency. Your doctor can perform stool tests and imaging to determine the cause, and catching a problem at this stage means you are addressing it before it progresses further. Remember, the goal is not to panic over every symptom, but to pay attention to changes that persist, because your body is communicating something important through these signs. Sign number 5. You see bright red blood on your stool in the toilet water, or on the toilet paper after you wipe, and this is never normal. Bright red blood usually means the bleeding is happening in the lower part of your digestive system, close to the rectum, where the blood has not had time to darken. Many people immediately assume this is hemorrhoids, and while hemorrhoids are a common cause of rectal bleeding, they are not the only cause, and assuming is dangerous. Research from major hospitals shows that one of the most common reasons colorectal cancer is diagnosed late is because people self-diagnose bleeding as hemorrhoids without getting checked. The key difference is this: hemorrhoid bleeding tends to come and go with flare-ups, while cancer-related bleeding usually continues or worsens over time without stopping. You might see just a few drops of blood, or you might see enough to turn the toilet water pink, and the amount does not always indicate how serious the cause is. What to do? If you see any blood after a bowel movement, even once, write down when it happened and whether it happens again in the following days or weeks. If the bleeding persists for more than a week, or if it comes back repeatedly, schedule a doctor visit immediately, because this is a sign that always deserves evaluation. Your doctor can perform a digital rectal exam and a colonoscopy to see exactly where the bleeding is coming from, and rule out serious causes like tumors or polyps. Important warning: never assume that bleeding is just hemorrhoids without getting it checked, especially if you are over 55 and this is a new symptom for you. Some people delay seeing a doctor because they feel embarrassed talking about rectal bleeding, but doctors see this every single day, and early evaluation can save your life. Bright red blood can also be caused by anal fissures, infections, or inflammatory conditions, but the only way to know the true cause is through proper medical testing. This sign is especially urgent if you see blood together with other changes like mucus, thin stool, or a feeling of incomplete emptying, because that combination needs immediate attention. Catching the source of bleeding early, before it progresses or causes complications, means treatment is simpler, less invasive, and far more likely to result in a full recovery. Sign number 6. Your stool becomes dark, tarry, or black, with a sticky, almost shiny appearance, and this is different from normal brown stool you're used to. This type of stool, called melena, indicates that there is bleeding higher up in your digestive system, in the stomach or upper part of the small intestine. When blood stays in the digestive tract for a longer time, stomach acid breaks it down and turns it dark, almost black, giving it that distinctive tarry look. Many people see black stool and assume it is caused by something they ate, like black licorice, blueberries, or iron supplements, and they do not think twice about it. While certain foods and medications can darken your stool temporarily, truly tarry stool has a very specific sticky texture that is hard to mistake once you know what to look for. Research confirms that dark tarry stool is a red flag for gastrointestinal bleeding, and while it can be caused by ulcers or medication side effects, it always needs evaluation. What to do? If your stool turns black and tarry, and you have not taken iron supplements or eaten anything that could explain the color, contact your doctor right away. Your doctor will likely order blood tests to check for anemia and perform imaging or endoscopy to find the source of the bleeding and determine the best treatment plan. This sign is particularly important because it indicates bleeding that has been happening for a while, and the longer bleeding continues, the more blood you lose over time. Important warning: do not wait to see if black stool goes away on its own, because ongoing internal bleeding can lead to serious anemia and other complications if left untreated. Some people dismiss black stool because they do not feel sick or in pain, but remember, colorectal cancer often progresses without causing obvious discomfort in the early stages. This sign can also be caused by stomach ulcers, gastritis, or even certain medications like aspirin or anti-inflammatory drugs, but you need a doctor to determine the cause. If black stool appears together with fatigue, dizziness, or shortness of breath, these are signs of significant blood loss, and you should seek medical attention immediately. Early detection of the bleeding source, whether it is cancer or another condition, means you can address it before it causes more serious health problems down the line. Sign number 7, and this is the most surprising one: bleeding that you cannot see at all, hidden blood that turns your stool color completely normal while silently draining your body. Colorectal tumors can bleed slowly into your digestive tract day after day, but the amount of blood is so small that it does not change the appearance of your stool. Over weeks and months, this hidden bleeding adds up, and your body starts losing more red blood cells than it can replace, leading to iron deficiency anemia without any visible warning. The American Cancer Society confirms that anemia caused by invisible gastrointestinal bleeding is sometimes the very first sign that leads doctors to discover colorectal cancer in patients. You might feel tired all the time, weak, short of breath when climbing stairs, or notice your skin looks paler than usual, but you never connect it to your digestive system. Many people over 55 assume fatigue is just part of aging, and they never think to check if something internal is causing it, especially when there is no pain. This is exactly why this sign is so dangerous. It happens completely silently, without pain, without visible blood, and without any obvious bathroom changes at all. What to do? If you feel unusually tired for weeks, especially with shortness of breath or dizziness, ask your doctor for a complete blood count test to check for anemia. If your blood test shows low red blood cells or low iron, your doctor will investigate the cause, and one of the first steps is checking for hidden gastrointestinal bleeding. There is a simple at-home test called the fecal immunochemical test, or FIT test, that detects hidden blood in your stool even when you cannot see it with your eyes. This test is incredibly accurate, easy to do at home, and if it comes back positive, your doctor will recommend a colonoscopy to find the source of the bleeding. Important warning: do not ignore persistent fatigue or anemia, especially if you have no other explanation for it, because your body is telling you something important is happening inside. Some people take iron supplements to treat anemia without finding out why they are anemic in the first place, and this can delay the diagnosis of a serious underlying condition. This is the most counterintuitive sign on the entire list, because it proves that colorectal cancer can progress silently, without pain, without visible blood, and without any obvious bathroom changes, which is exactly why early detection through screening and attention to subtle symptoms is so critical for people over 55. Here is your action plan. Treat any of these signs lasting more than 2 to 3 weeks, or 2 signs appearing together, as a reason to see your doctor calmly. Ask for a fecal immunochemical test, or FIT test, which you can do at home to check for hidden blood, and follow up with a colonoscopy if results are abnormal. Request a complete blood count test to check for anemia, especially if you feel unusually tired, and do not self-diagnose persistent bleeding as hemorrhoids without confirmation. Now, important precautions. If you take blood-thinning medications, have a history of inflammatory bowel disease, or have any chronic digestive conditions, mention these to your doctor. These signs can also be caused by infections, hemorrhoids, or other non-cancerous conditions, so the goal is not to panic, but to investigate calmly and rule out serious causes. Always talk to your doctor before making any major changes, because early detection is about paying attention to your body and acting on what it is telling you with care. Imagine waking up tomorrow knowing you caught something early, that you paid attention when your body whispered, instead of waiting until it had to scream at you with pain. If this video helped you today, please hit the like button, share it with someone in your family who needs to hear this, and check the 2 videos on your screen. Your health is the foundation of everything you do, and taking care of it starts with something as simple as paying attention. So keep learning, keep protecting yourself, and I will see you in the next video. Your health is the foundation of everything you do, and taking care of it starts with something as simple as paying attention. So keep learning, keep protecting yourself, and I will see you in the next video.